My name is Yvonne Ito, and I'm the public health program manager for this emergency prep program. Some more people are coming in. That Johnny Delgado
Yvonne, you're cutting out.
And from the American Indian Health Services of Chicago. I hope they will join us later, as they were what we call storytellers from last year, and they are also joining again the second year. So I want to thank you. Let me turn off my camera just to give me more bandwidth. Is that better? Can everybody hear me okay now? Okay, so as I was saying, my name is Yvonne Ito, and I am the program manager of the emergency program. This information today is on the Storyteller program. Okay, could I have the next slide, please? Could I have the next slide, please? I want to welcome all of you for joining us today. I know it took you're all busy schedules, so I really appreciate you taking the time to be with us today. Could I have the next slide, please? So for some housekeeping rules, please turn on your video. Of course, for those of you who are having bandwidth problems, such as myself, I'm going to turn off my video. Please mute your microphone when you're not speaking so that we can prevent echoes. And please enter your name and organization in the chat box should you have a comment. Please note that this session will be recorded for educational and quality improvement purposes. We want to thank the Center for Disease Control and Prevention for the Department of Health and Human Services as part of the Financial Assistance Award totaling $100,000 with 100% funded by the CDC. The contents are those of the author and do not necessarily represent the official views nor endorsement by the CDC or the U.S. government. The National Council of Urban Indian Health is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in the areas. NCUIH is the only national representative of the 41 Title V Urban Indian Health Organizations under the Indian Health Services in the Indian Health Care Improvement Act. NCUIH strives to improve the health of over 70% of American Indian and Alaska Native populations that live in urban areas, supported by quality health care centers. Our agenda today is an overview of the Storyteller program and a Storyteller testimonial from Mr. Johnny Delgado, who is from Bakersfield American Indian Health Project Storytellers. He will give his experience of being a storyteller last year. And then hopefully Mr. Joseph Flores from the American Indian Health Service of Chicago will be joining us. After they speak, we'll be having an open discussion, and then we'll wrap up, and thank you all for attending. The objectives of this program is to provide information about the Storyteller opportunity and the roles and responsibilities of the storytellers. We will learn from past storyteller experiences with the program and the resources acquired to better support their organization's emergency preparedness initiatives. We will provide an overview and a walkthrough of the Storytellers application process. Our program overview. This project will develop the capacity of urban Indian health organizations in COVID-19 preparedness, response, and vaccine dissemination. Through COVID-19 prevention and control in urban Indian health programs, NCUIH will work closely with up to 41 urban Indian health organizations to address public health priorities related to COVID-19 by supporting UIOs, public health, emergency response, and vaccine implementation planning. The activities for this program includes talking circles. We will offer SMEs that will offer assistance, provide office hours and training webinars. Our storytellers, we will share policies and procedures and protocols, assist with trainings, and ambassador for care centers. We will offer assistance to the UIOs that consists of training, webinars, office hours, and discussion board. We will offer a talking circle on emergency preparedness. We'll discuss the needs and the activities that other UIOs are participating in. We will offer support for the health centers provided by subject matter, and that includes office hours provided by the SMEs, one-on-one technical assistance, training webinars, and assistance provided on a review, comment, and finalizing of any plans on UIO emergency preparedness, response, or vaccine plans. And we can provide training to staff to successfully implement plan develops with support of the SME. Our subject matter expert is Linda Zambrano, and she has over 25 years of experience working in working with tribes on emergency preparedness. Our previous storytellers have been Hunter Health, the South Dakota Urban Indian Health, and the Urban Indian Center of Salt Lake, Bakersfield, and Chicago. The storyteller's responsibility throughout the year is to share your documents, policies, and procedures on standing operating procedures, any trainings or templates you have. This will help us share those with other storytellers and in hopes to enhance all of the programs. We will strengthen programs with reviews, edits, and SME support. And the goal is to provide technical assistance that includes trainings, talking circles, templates, and meetings. So overall, we're not asking, I know some people will think, oh my gosh, we're so busy right now. We just don't have any time for anything else. But most of what you're doing, most of what we're asking for is what you've already been doing. So it shouldn't put on any more work on your plate. And when Mr. Delgado speaks, hopefully he can confirm that. We will have platforms utilized to share with your stories from the Storytellers. That includes SharePoint on the NCUIH website, the NCUIH newsletters, trainings, and webinars. We will offer professional development opportunities, and then we will have an evaluation so that we can know how to enhance our services to provide better services to our UIOs. So at this time, I would like to ask Mr. Johnny Delgado if you could please speak with us, Johnny, on your experience as being a storyteller last year and give some words of wisdom to the others listening on this so that we can recruit for some new storytellers. Thank you, Johnny.
You're welcome. Hello, everyone. Good morning or good afternoon, I guess, depending on your time zone. BIHP applied for Storytellers, the first round, which was for this year, and we used it to specifically for emergency preparedness. One of the biggest things that we hadn't addressed, and it could have been a huge concern, is when we purchased a new facility last year, and this grant happened to come around before we moved into facility. And when we read what it was about, we realized we didn't have an emergency action plan. If something were to happen at the facility, we didn't have diagrams and drawings. We didn't have fire extinguishers laid out throughout the building. We hadn't done any of that. So we really used the Storytellers funding to implement a lot of those processes, develop the policies for them, and actually do the work to set it up, getting the fire extinguishers, buying the signage for it, improving access control of the facility. And then for this year, we're going to be continuing to enhance what we have. With it, a lot of staff development training came in as well, in terms of we hired a third-party contractor to do a lot of the work for us. We did several walkthroughs of the facility while it was going through the renovation. So we incorporated additional recommendations into the renovation process. And some of it is just, emergency exit signs. One of the biggest things that was a challenge was egress. And I'm not sure if people know what egress is that in event of emergency, you have to leave the building. There can't be anything to block your movement or impede your movement from evacuating to a emergency evacuation point. And so that was really a challenge for us because the area we lived at, we want to make sure, not live at, but the area our facilities in, we want to make sure that our building's secure. Our external gates, we want to make sure they're secure. Obviously, there's a front gate that's open for people to come in, and that was a big challenge. And so with it, we worked with the contractor to come up with something that we believe was to be, a reasonable way of securing the facility, but also allow for the flow of egress, and to meet any other legal requirements we have as well. In the state of California, you just don't worry about OSHA, you worry about Cal OSHA, which is generally stricter than OSHA. And there's a lot, of course, state and local other ordinances as well, in addition to that we have to follow. The contractor we had was very familiar with it. And he was able to help us come with a plan to get everything done. And the Storytellers funding is what primarily paid for it. For year two, we plan on increasing our what we have in place at the moment, though. I haven't fully come up with a plan for that yet, though, but I'm thinking more of a PA type of system, possibly other ways to secure the facility as well, and just be ready in the event something happens. We have our code list that we developed under this plan as well. There's several different colors. I don't have one right now, sorry. But we're going to be pushing those out, and on the employees' ID badges, we're going to have them printed. In the event of emergency, they can easily call the code out, and they know if there's a response that's needed. We had a situation just a couple of days ago where we had to speak with somebody who we were afraid that conversation would the severity of that conversation would cause the staff to call 911. So right before the meeting, we reviewed our code list. We informed the managers what was going to happen, made sure staff were aware of the code list as well. So if something were to happen and we called the code, they know how to respond. If someone calls these codes, call 911. But overall, it went great, though. There was a lot of, like I said, challenges that we had in terms of getting our facility ready to be occupied, but the Storytellers grant was what funded us to do that extra work and paid for that contractor, paid for the training that the staff needed, and really developed all the material we needed, though. So as we move forward, we want to enhance what we have and continue to grow, and that's what we're looking forward to. And I did want to say thank you, NCUIH, for giving us the opportunity to take part in the Storytellers grant. I think that's all I have.
I just wanted to, say that. Thank you very much. Is Joseph on the line? I can't see. or someone from the American Health Service of Chicago? Okay, well, hopefully he will join us before the end. So could we have the next slide, please? Yes, thank you, Johnny, very much. Could we have the next slide? Does anyone have any questions about the Storyteller program? At the end of the last slide, we have a link to the application program that we would hope some of you would fill and be willing Storyteller for year 2. But at this time, does anyone have any questions that we can answer? No? Could we go on to the next slide, please? You can also put any questions in the chat. Micah Grant, who is one of our program coordinators, is monitoring the chat, and we will make sure that you get any answer that you need. When you are a storyteller, this is a form that's a technical assistance request. If you need help developing form or whatever you may need, this technical request form is something that you would fill out and send it to us, and so that we can prepare to service your needs. So NCUIH has been very busy, and we have several funding opportunities for our UIOs. This is a list of some upcoming events. On November 29th, we have a peer-to-peer solution center. So please save the date for this. On the Vaccine Equity Community of Learning series, please save the dates for November 10th, December 14th, and January 11th. And note that all these times are listed in Eastern Standard Time. There is an opportunity for electronic case reporting and a UIO sub-grant for year 2. The funding opportunity for ECR implementations, UIOs will be awarded $84,600 each. The application is on a rolling basis, and the job form link is there for your information. And then, of course, our emergency prep vaccine planning storyteller application. The applications are now open, and we are looking for 4 remaining slots. So this is the link to fill out that application. If you have any other questions, again, the awards are $30,000 for each UIO. Our deadline is November 30th. And there's the code for you to look that up. And if anything else I can help you with, please feel free to send us an email or put it in the chat box. And at this time, are there any other questions or feedback or any information about what other kind of services you could use, or anything at all, any feedback at all?
This is Johnny again. One of the things I just wanted to mention that we used, we did a lot of the work we did with the Storytellers grant ran along with a lot of the training that we did with the Project First Line grants as well. There was a lot of training that we discovered was needed while we were doing Project First Line, and the Storyteller grant was able to help cover some of that, though. A lot of that was like the heat illness, emergency preparedness, injury and illness prevention plan, and our COVID surge plan as well. So I just want to make mention of that as well.
Thank you, Johnny.
I just have a question.
Does anybody have?
Did anyone do
Yes,
it
ma'am.
specifically for senior citizens or elders? regarding
This past,
preparedness?
not this past year. It was just an overall, for each. We would definitely work on that project with you if you need assistance in that category. That's one of my passions, is providing services, and so we hope you apply for the application to become a storyteller.
Thank you.
Most welcome.
Donna, we didn't do anything with the seniors for in terms of this grant. However, part of our the funding was used to address several issues we had in the facility, such as like the concrete in some areas was uneven. So we had to grind down the concrete, which we grinded down instead of breaking it. But we had to do a lot of infrastructure work like that to make sure that there wasn't any tripping hazards, and that the, like I said, the flow of traffic, so egress, wasn't interrupted though. So we didn't do necessarily anything directly targeted towards senior. However, some of the work we did, definitely benefited them in a sense, to make sure that there was a reduced risk of slipping, falling, trips, and such. We actually received additional funding though for a tip cap grant through IHS, and that we do a lot of specific things for seniors though to reduce slips, trips, and falls. But it's all mixed together as much as possible. We pull from everywhere we can.
Well, I was thinking of something a little different because, I guess I focus too much on disasters, but we've had some like apartment fires. When we built affordable housing, I made sure I had an area that could be used for tenants to get together in case there was a disaster, not necessarily impacting them, but if they just felt more safe if they were with other people. And then just also thinking that we have had a couple of apartment fires and just other things that in our community, they would be considered a disaster. So just coming up with a disaster plan, or at least some information targeting seniors, like having a go bag or having 30, 60, 90 days of prescription medication that they could grab if they had to leave their residence. Something like that is what I was thinking. So, but thank you for your suggestion.
That sounds great. We actually,
And Donna, that is some.
sorry. I was gonna say, we did do emergency bags ourselves,
No, go ahead.
but for the office. So we actually did a couple with first aid kits, flashlights, batteries as well, water, because we have kind of like a split building. So we have one on each side, and we designate who the coordinators are that have those bags. So the bags you said, I think is a great idea. And because it's for planning and developing the resources, I would think you'd be able to utilize it. But of course, I'm not the one approving it. So.